Hi everyone, this is Ali here from PX Pulse, and we're bringing here a great webinar for you around how do you keep a pulse, how do you keep a proactive pulse on patient experience using machine learning. We have a great panel here. We've got Devyani Chaudhary, who's a pediatric cardiologist, a great enthusiast and evangelist for patient experience transformation. We've got Dr. Babar, who leads the service line for PEDS at AKU Hospital, and he's gone through that whole process of transformational process of bringing patient at the center of everything that his practice, his service line does. We've got Munira here, who's an organizational psychologist, has worked on the transformation initiative at AKU at the PEDS service line to transform the whole service provisioning from a patient-centric point of view. We also have April and Cynthia here. They are going to actually add the real voice of the patients into these discussions. So thanks everyone for joining in. I would like to have a quick introduction, starting with you, Devyani.
Thank you for having me on this webinar. So I'm a pediatric cardiologist. I work in central Pennsylvania. My passion is to, I do work with the vulnerable populations like the Amish community, and I'm really excited about this project of a patient experience and having it real-time dynamic process for our patients so we can actually make a big difference. Thank you.
Thank you very much, Ali, for having me on this great webinar. So my name is Babar Hassan. I'm a pediatric cardiologist by training. I trained in the US and did my residency from Indiana, and then did my fellowship from Boston, and then came back to Pakistan to work at the Aga Khan University. And currently I'm leading the pediatric or the Children's Hospital service line. And I've been leading it for the past 2 years, and one of my biggest passion has been how does one convert a physician-centric place into a patient-centric place, because what we are in this profession purely for our patients and for their experience and their outcomes. So thank you for having me on this webinar.
Sure. Thank you, Ali, very much for having me on this webinar. I'm a public health researcher and a practicing pediatric psychologist at Aga Khan, with also significant experience implementing behavior change intervention trials. And my role for the past 2 years has been how do you take the science of compassion and scale it up into entire organization. So that has been my passion in the past few years.
So I'm Cynthia. I live in Pennsylvania. I am a mother of 3 daughters, and I have actually been in healthcare since probably the age of 17.
Hi, my name is April Barber. I'm a mother of a daughter with congenital heart defect and also a complex disease called CHARGE syndrome. I also pioneered or co-founded a local organization, an event called And the Beat Goes On, where we connect families and bring them together and help to support them in the hospitals and in daily lives.
Thanks everybody for joining in. Really appreciate all the different inputs and perspectives that you bring in. Especially we wanted to have the voice of the patient right into the webinar, because most of the time we either hear technology people or healthcare providers talk about what the patient wants without giving the voice right into the discussion of from the patient themselves. So thanks for joining in and giving your perspectives on this. So let's start with the key idea. How do you create a patient experience that makes patients fall in love with the hospital? I mean, that sounds like a crazy idea that, why would you even fall in love with the hospital? But, it's all about, when you talk about the emotions, they are as heightened emotions as you would find in a hospital, you would never find them anywhere else. So if you can really care and love the patient and take care of them, they're definitely going to fall in love with you, because in that moment of vulnerability and those emotions, if you do the things right, they are we strongly believe they're going to fall in love with the hospital. And at the same time, how do you enhance the reputation, reimbursement, and resource efficiency for the provider or the hospital itself in order to do so? Now let's talk about the problem standing in the way of achieving this. The conventional patient experience is broken. And when I say broken, I mean that it's not real time, it's not predictive, it's not personalized for each particular patient's context. And this results in the disconnected, reactive, and non-personalized patient experience, which ends up costing the hospital its reputation, first of all, and also the reimbursement dollars, because now more and more the patient experience matrices are starting to get linked to the reimbursements as well. And obviously the resources too, because you're all over the place and you're always in a firefighting mode, so you're never going to be efficient with your resources either. Let's try to picture that, that broken patient experience that I've talked about. So all the way from the somebody showing up in the ER or getting an appointment, and all the way through the provision of care and the follow-ups and everything, when all of that has happened, when they've actually been admitted and everything has happened, at the end of it, we start taking their voice into the process through HCAP surveys or Press Ganey and whatever. We collect a lot of data. We have a lot of data in our EHRs. We don't really utilize that data in the real time to do anything of meaning for a particular patient. And even when we collect this data, the time has already passed. So you can do all that we want in a retrospective fashion, but that's not meaningful for that patient that already gone through that journey. So let's talk about the stages of that patient journey. It starts with the awareness, as you would guess, about the disease, about the problem, and then you research about what the providers are, what the urgent care facilities are close by, whether or not you need to go to the ER directly or you should get an appointment. So that's the awareness phase. Then you either get an appointment or show up in the ER. And then from there you get the provision of care. Depending on whether or not that provision of care was patient-centric or was within your context was relevant to you, you're either going to become very loyal to that provider or you would swear to yourself that you're not going to see them again. And depending on how that process goes, you will have a magic moment where you actually become an advocate for that provider. So those are the key stages. Now let's talk about the journey, and more so the emotional journey. So while you are getting aware, you have a lot of anxiety because you don't know what the problem is or what extent of that complexity is. And obviously you're in the stress, you're calling up to schedule an appointment. Maybe you get an appointment after a week. You would like to follow up on the call to maybe get it done earlier. You get in an ambulance, maybe you show up in the ER room. So all of that is happening while all those emotional ups and downs are happening with you, especially the downs. And within this whole process, while you end up at the admission desk, you need to know whether you are pre-authorized for the procedures that need to take place. So that creates a lot of frustration as well. So all those things start happening while, and the interesting part is this is very unique for one patient. This journey is very unique to one patient. Every other patient might follow a different path or have a different emotional state at every point in time. So there is no easy way to say that, I'm going to have a brilliant process that's going to take care of all my patients and all the journeys. And this is where a lot of data that is being generated right now through this process, unless that's taken into consideration through some intelligence, or some sort of a machine learning or AI model, which can define the moments of truth or the factors that are impacting that predicted patient experience score. So on the left, you see all the touch points that a patient comes across. On the top here you see all the stages, and all these boxes that you see are the moments of truth, or what we call the impact factor, that are going to impact the emotions and hence the experience of the patient. So just imagine if you're able to sort of predict all of that all of these boxes, which ones are going to be red, which are going to be green, which are going to be yellow, and what you can actually do proactively to intervene on that. So before we get too detailed on that, let's have a reality check from the actual moms from Devyani, over to you, children who have gone through those cycles, and Cynthia, and let's hear them out to see how real this problem is.
So interesting, Ali, the graph that you showed, and many of us who are in the clinical world would agree that we kind of do that part for many of our patients. We call the ER, we'll tell them where to go, you kind of try to be that AI piece that you're trying to put into place in a more organized fashion. But that's more so with pediatric population. The more adult or geriatric the population gets, that personalized care is lost, and it's also lost sometimes in a big corporate structure where you have lots and lots of patients, and how do you maintain that individualized space? So your daughter has been through heart surgeries and has had a pretty long journey. And I know 5 minutes is too short to describe what you've been through. So can you just kind of highlight for us, you know, what comes to you and now sitting back, what was the patient experience that was good or bad, you know? So.
Yeah, so as I mentioned earlier, my daughter has a congenital heart defect, and about 2 years into her journey, we learned that she has CHARGE syndrome. So she sees about 15 specialists. She's had 20 plus surgeries, 3 of them being open heart, and we've had multiple different hospital experiences. So I'd like to share kind of our initial experience and what that was like as a new family in a new emergency with a whole new situation, and then kind of what it's been like now as a seasoned family 7 years into it, what we deal with week in, week out as we venture into the hospitals. So first, when she was born, we didn't know that she had any issues. At her 24-hour screening, we learned that she had a congenital heart defect, and panic sets in, shock. I think that we were all kind of, you know, just raw at that moment in time, and waiting for answers. And I think that that was really hard, the process of waiting and not knowing, and they weren't really sure what to say or what to say to us. We were in a small local hospital, and she needed to be transferred to a level 1 trauma center where they had the capability to take care of her in an intensive care unit that would suit her needs, and then be able to set her up for cardiac surgery. So my husband went with her, and I stayed behind. And so there's a lot of just fear and overwhelm and anxiety related to what are they doing with my daughter, what's going on, and lots of questions that come up, you know, initially as a new parent, and then dealing with this trauma. And relief finally came when my husband stood next to a cardiologist who did an echo on our daughter and told us what was going on, and kind of drew pictures. Sounds silly. He turned over a napkin and drew pictures for my husband. And when my husband relayed this message to me, because I was recovering from a C-section and I couldn't be with them, and telling me, you know, what was going on, there was just, okay. Still a lot of questions and not knowing what would be next for her young little life. But we made the connection right then and there with that cardiologist, and we stayed with that facility for probably longer than we should have, because of the connection that we had with that cardiologist. And so we get through those first couple days, and then we learn that her insurance company is denying the procedure. They will not do her open heart surgery, and they want us to put our child who's in heart failure on a helicopter and fly her to a lesser qualified hospital, where she would undergo a procedure done by a surgeon that was trained by the surgeon in the hospital that we were currently at. And we were like, no, what's going on? And so again, that relief turns to fear, to overwhelm, to frustration, to anger, to what is going on here? What is wrong with the system? What is keeping our daughter from having this surgery? So what I know now is that the system probably failed us in that moment. But what I can say is in those 3 days, we watched her go into heart failure. We watched her little body heaving, and her heartbeat shaking her entire body, and her just struggling to breathe. And I believe that her 3-week recovery in the ICU post-surgery was in part due to that delay. So not only did it affect her health, but it affected a lot of other things. And so fast forward, she's discharged. The next 2 years of her life, she's in and out of the hospital over and over again. And so we'd go home, we'd have a major event. She would drop her saturations into the 40s. We're calling the ambulance. We're on the ambulance, heart pounding, going back to the hospital. And this happened multiple times in those 2 years. And so who we were as a family in the beginning and who we are today is totally different. And so I love that this process is going to help you as providers, you as clinicians, to be able to adapt to each stage that a family goes through. Because now, 7 years in, the hospital is our second home. And when you say we want our patients to love the hospital, it's true, because really you have to let your patients like us, who are chronic repeat people in hospitals, to be able to feel at home wherever they're going. And so now the decision is, number one, where are we going to go? Most of the time we drive 2 hours to go to a hospital. And then we know that it's going to take 2 hours to get there, and no less than 6 hours sitting in the ED, the ER. And honestly, before we go, I'm talking to our cardiologist, our pulmonologist, and getting my game plan together of what I'm going to say. And I repeat the same thing to the receptionist, to the intake person, to the nurse, to the intern, to the fellow, to the doctor, of what I need, what tests need to be done, what needs to be done for her, why she's different than every other patient, and on and on and on. And it's now, of course, not every person who walks through your ED is going to be like us, who has a different scenario, but it is exhausting. And my husband and I were talking about this last night, and he's like, I watch you do this dance with the providers, and we go back and forth and back and forth. And sometimes he has to step in and say, wait, let me help you figure this out. And then in that process, we get where we're going. It takes a while. It's quite exhausting. And so till we finally get to the floor or the ward, it's often the middle of the night. People laugh at us when we walk into the ER, because we come in with a rolling suitcase with all the food, all the toys, all the clothes, everything that we're going to need so that we can weather this storm. And honestly, until now, until hearing about this patient experience and making it different, we'd given up hope that our life was going to be any different than this, that the process of going to the hospital and the exhaustion and repeating ourselves 5,000 times just to get the care that she needs was going to be any different. And so I am excited. First of all, thank you. I'm grateful. I'm amazed that you guys are here on this webinar, because that means that you care and that you're ready and willing to make a change so that families like us can have faith in the institution again and know that our life isn't, have hope at least, that our life won't be totally turned upside down through this process, and that we can really focus on taking care of our sick children and streamline some of these things so we have a better experience.
Right, and what's really interesting on this, just a quick point, very interesting what April just said, that she actually predicts while she's driving 2 hours to the hospital, she's actually predicting what's going to happen, and she actually is being proactive about that by making those initial contacts with people that are going to take care of her family, right? So now it's about time that the providers start doing that too, right? They start getting predictive, they start getting proactive. And that's what the whole idea of having a PX transformation journey is all about.
Yeah, so I think one of the other comments I would make here is all the things that April said and that they brought up. So where does AI fit into all that? So instead of the mother being that advocate, which is going to change depending on the mother, depending on the social environment, there are several factors which alone can serve as a trigger, right? That's what we are trying to say. So as April said, drive 2 hours. So any mother driving interstate, driving 2 hours, that should trigger a different level of an algorithm saying that, okay, this patient has a different knowledge versus trying to now navigate with a new intern or a new resident or a new nurse or somebody who doesn't know you, you know. So AI is supposed to take away those pieces and add this compassionate human touch to this care. So Ali, I think we can bring Munira and see what she has to say about that, you know. So.
Yeah, absolutely. So I think the whole story that just April just narrated, I think the key here was that the whole cycle of different emotions that were that she and her family went through, coming across all the different touch points within the provider setting. What is the key thing that's going to make all the difference is the compassion, right? And what Munira and her group has done is, she's mapped out 9 principles of compassion with the patient experience. And that's something that we've built into our machine learning model as well. So let's talk about those 9 things, Munira, and how you've been able to bring all those together from a patient experience transformation standpoint.
I thank you, Ali, and thank you, April, for setting the scene up. Yes, so what we have tried to do here at our hospital is all that anxieties or all that worries and concerns that patients come in, all they need is at that point in time to have someone just show them some compassion, someone to make them realize we are here for you, someone to empathize, someone who just acknowledges the pain that one goes through sometimes is that's enough for patients coming here. And what our role has been and what we have been trying to do is how do you translate this complex science of compassion, which also has neural basis to humans, and how do you translate in a way that's not just that people are practicing it, but it's in organization, it's something that becomes part of the DNA of the organizations. It's something that is sustainable and that comes when it is measurable and it comes when it's rewarded as well. So we have tried to use a model of compassion using 9 principles and breaking them down into the different job descriptions of them. We started with the nursing and how do they practice in their daily jobs. So it's something that they feel is not over and above what they're doing, but it is integrated into what their everyday life is. For example, if they are being very if they're concerned they're not making any medication errors or checking the child ID bands, they are being mindful at their job. And if they are on time, if they are reporting the medical errors, that means they're showing integrity. So what I think the concern has been if AI comes in or if there is more of technology, we might lose on the human element. But I think it's the other way around. Actually, we can use technology to better predict what human element can be, the strength of one of your nursing staff, and what can be best aligned to the needs of these patients. So we have not just in this framework, we have not just broken down compassion into something measurable and sustainable and something that can be rewarded, but we also have amalgamated technology. How do you really predict and then you improve on the staff that requires those skills to what the patient requires.
Right, and then obviously there's that link between that emotions that are there and the skills that you need in order to reverse or do a service recovery, right, from an emotional standpoint as well. Now this is all great, like all these great ideas and our passion to make those changes. But obviously there's one elephant in the room that nobody talks about, and that is the status quo, right? And that status quo is what first of all, assume that this is not in alignment with the provider's ROI or their key performances. But we have Dr. Babar here, who's actually gone through that whole process in the last couple of years of bringing about this transformational change within his institute. So Dr. Babar, how's the leadership that you've shown played a part in bringing about this important change within your service line?
So thank you, Ali. So first of all, thank you for giving me this opportunity to speak about something that is very near and dear to my heart. And so I also my brother had a congenital heart disease, and he passed away at the age of 29 with congenital heart disease, and that kind of shaped a lot of what I've done in my life. So I've been on the receiving end. I've been on the receiving end when my dad was passing away, and also on the receiving end when my brother was passing away. So I think that is what kind of shaped all the training and all the ethos at least that I had. And when I came into a leadership role at my institution where I am currently, what I saw was a system that was had pretty significant flaws. We talk about the patients. We say that we are there for the patient, but we are very physician-centric. Just look at the academic medicine. The way we value outputs or physicians' outcomes is, especially in academic medicine, is the impact factor of a journal. Where did we publish? How big that journal is? And nobody actually looks at, or at least strives to look at what is the actual outcome on the patient. And I think that is a major paradigm shift in the way you think. And in a country where, just to give you a sense of statistics, quality physicians to patient ratio is anywhere between 2,000 to 4,000 patients to one doctor. So, you can imagine the hierarchy in medicine, and trying to shift that dial from a physician-centric model to a patient-centric model was a huge undertaking. I think the biggest thing was to kind of have the greater leadership at the institution believe in this, because everything, when you actually think about it and you say it's, whatever I'm going to do, whatever the institution is going to do, is going to be around the experience that the patient is having in one of their most vulnerable times in their life, especially if it's a pediatric patient. You can imagine the stress that the family is going through. Then everything that you do, every touch point that the patient has or the family has, it is kind of centered towards making their experience better. And it's not just, experience is not something which is kind of, just a touchy-feely thing. There's clear literature that has come out now that the better the patient experience, the better their outcomes is. One of the, if your outcomes are good, it also adds to the patient experience. But thinking of patient experience on the whole journey of care, on the life cycle of care, is what we did. The biggest challenge was to make people have that mindset, and then change some really old habits. And I think the biggest thing by which that helped us kind of change some of those habits were to become data-centric. So collect data, collect robust data, and then use that data to actually convince people that, they have to change. And then be consistent and be at it all the time. And majority of the times over our journey, we've been reactive to whatever was happening. And as the data started coming in, we ourselves had our own kind of intelligence, or made up an artificial intelligence in our minds that, okay, fine, if this is the patient who comes from this demographic, this, they have a child with chronic disease, they're going to be in the ER for these many hours. By the time they come to the bed in the ward, they will be in a pretty unsatisfied state of mind, and their stress level is going to be high. So, we said, okay, fine, if we as physicians and care providers have developed a sense around this, can we use data and start predicting, so that we can, as soon as the patient hits the ER or even before that, and we start predicting that, there is going to be some kind of unsatisfactory experience that this patient is going to go through, and then which factors are actually contributing towards that, and then creating a framework of intervention. You just can't have a predictive model and sit on it. One has to create a framework around it. One has to build it into the DNA, as Munira was saying, and really deliver that compassionate care. So I think that's what's been our journey. It's been a journey of ups and downs, but every time we have looked back, we've seen that we have come a long, long way. And I think it's really exciting to see this movement kind of coming along.
Yeah, thanks for a great insight into the whole process that you went through in the past couple of years. And that's something to learn from, how you started with an idea, and then how you had to get everybody together and change that status quo for the better, right? So thanks a lot for that. The other thing we'd like to also touch upon is, like you briefly mentioned, and especially in case of April and Cynthia talking about it, the demographics, where you're coming from, what sort of, how many kids you have, what is your education level, what is your financial status, how far is the hospital from you, what's the clinical history, all of that sort of tie into creating that patient experience, creating that moment of truth like we've been talking about.
So, how the patient experience.
So it's extremely important from that perspective. Now, if we talk about that, I think there's the other part which is extremely important. Okay, so there, the 3 P's and the 3 R's. I think it's extremely important to understand that relationship, because when you're about to change the status quo, and when you're adding these ideas of predictive and being personalized and proactive about the patient experience, you need to think about the sustainability of it. Now, how sustainable is that process? And it all goes down to the 3 R's that the hospitals are extremely worried about. In addition to the regulation, which is definitely always there. The reputation of the hospital, the reimbursements, and the resources. Now, when you are being predictive, like you all just talked about, when you're being proactive, your reputation is definitely increasing. And what that means is, more word of mouth referrals coming in to your hospital. What that also means more increasingly now are the reimbursements, because now using the HCAP scores, the CMS has started tagging the reimbursements based on at least 30% of that amount that they retain is redistributed based on what HCAP scores you are getting. And that's going to keep increasing as we move forward. So the reimbursement dollars are directly now getting more and more increasingly attached to the patient experience that you're providing. Thirdly, the resources. So when you are being proactive, you are actually able to plan ahead your resources much better. And you're not in a firefighting mode. So you can proactively plan better, and that would mean that the efficiency of your resource utilization is going up. So all the 3 R's that there are all directly related to the 3 P's that you're trying to create from a patient standpoint. And this is what is going to actually make it happen, because that way your CFO is going to be on board. Obviously, your chief experience officer is mandated with this, but unless the CFO is on board with such initiatives as the top line or the bottom line that are linked to your provider from a provider P&L perspective are linked to this, is extremely important. So let's talk about the reimbursement a little bit. We touched upon that the HCAPs are now starting to get linked with this. Even if they're not, like even historically, when you see starting from 2008, where value-based healthcare movement started, you're seeing that the better the patient experience score, the better the profit margins. And that's pretty consistent throughout the years and still today. So let's talk about the solution a little bit. We all talked about all the different contexts of different situations, different data points. Now let's talk about how you can utilize all those data points from the different stages of that patient journey to be able to predict the patient experience score. Imagine where you can actually predict the HCAP score before you've actually started giving the care, and then being able to not just identify the score, but also identify the exact factors of that are going to impact that score. And then being able to proactively trigger some interventions based on that, some things that you can do in order to improve those factors and hence improve the patient experience score. And then being able to collaborate both within the care team and beyond in order to do those interventions. And then being able to monitor all that. So going back, just to refer back to these different touch points, different stages, different emotions, and different impact factors. If you can combine all of that into one data model, into one machine learning model, you can get the insights that are going to help you identify exactly the next step that you need to perform and exactly the type of intervention that you need to do. What you need to tell April when she is in the waiting area in the ER, what you need to proact in terms of getting the pre-authorization done, like she said, when the surgery got delayed because of it. So when her baby was in the ER, could there be a proactive approach in trying to understand that this is the condition that the child is in the ER? There is a chance that this procedure needs to happen, and then being able to pre-authorize that and getting that pre-authorization process started earlier as opposed to later. And then being able to identify what the deductible is going to be, what her financial status is, and how important that copay and deductible is going to be for her as opposed to somebody else. So every journey, as we said, is going to be unique, and that's exactly why we need a machine learning model, an intelligent model, to be able to predict that and being able to identify how to proact and what to intervene with. So that's what you actually.
Ali, I want to make one comment over here.
Please go ahead.
One thing really important is that the traditional way right now is that the patient fills out a survey, which is then mailed a few days later, and the patient doesn't really benefit directly from that. The idea of the AI machine learning model would be that it's real time. And that's a really important point to make, that it's real time, it's triggered, And it not only affects the patient, but it also affects the caretakers. If they're doing well, that goes back to their supervisor, and it already logs into their file that they treated somebody right. Not like they have to now go back to memory, write certain things out and try to figure this out. So the most important point that I feel with this model is it's dynamic, it's real time, and the patient leaves the hospital already having a lot of their pain points touched upon and addressed.
Right. And basically, April, we would like to have your perspective on this. I mean, we're talking all geeky and we're talking all from our perspective with regards to what should be the solution. Like, can you envision a better patient experience or your personal experience if something like this was put in place?
Yes, I think just even being able to say one less sentence while I'm waiting in the ER to get the care that my daughter needs would make a huge difference. The stress level that families have, for myself, who I'm extremely educated, I've worked through a lot of things and taught myself a lot of things. Then you have other families who don't understand, who need more explanation, and aren't going to come in like I am saying, da 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 da, you know, I need this, 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 and this. And their experience is going to be longer than mine because they don't know how to advocate. And I think that having this ahead of time is going to make me say, we need to go in and let's go now versus let's wait a little bit, see how we do, and delay care because I don't want to sit there and fight with people for hours. So I think that this has the potential to make everyone's life so much easier. And
All right. And yeah. And Cynthia, can you pitch in on this? Is there something that you can relate to based on your past experiences?
I agree. I think that this movement is going to be a good thing for patients and for providers or the people, the care team. It's just going to relieve a lot of stress and anxiety on all ends. And it potentially can become something that is contagious because when you do something right the first time, it carries on to the next person and the next person. So if you get it right the first time, it doesn't mean that you will lack the next time, that you won't lack the next time, but you do have that that aspiration that you will do right because it's a contagious thing. So if you get it right the first time, it can roll over. It's a domino effect.
yeah, and I think, I love what you said. I think the providers that I'm walking into don't know me. They don't know my daughter's complex medical history. And this is a gift to the nurses, the doctors, the fellows, because they can walk into a room and already know what kind of patient they're working with. And that is going to make them feel better too versus playing, like you said, playing catch up. And then they've already disappointed someone like me because they don't know and they're not there. And that's not their fault. It's just in a big system, that's what happens. And so I think this real-time learning and this smart computer, let's say, is going to make a huge difference on both aspects, not just as a patient, but also for the team that's ready to greet me when I walk through the door.
Absolutely. And you know, if you think about that, it's going to actually need less resources on the provider's part as opposed to more. You don't need like 3 people telling you what you don't want to know as opposed to one person in that moment telling you exactly what you need to know. Yeah. Right. So even the lean management principles that are being adopted by different industries could be adopted here because of that ahead of time insight that can be generated through the model. So yeah, thanks for pitching in on that. That's really helpful because like I said, we can talk all day about what we think the patients think about such a system, but hearing the real voice is definitely important. So the idea really is that take all those data points in the real time, feed it into the prediction model, and then being able to not just predict the score, but also the intervention that need to happen, and then create that virtuous cycle throughout in order to not just predict it, but improve the score in the real time. So what we are talking really about, let's get into the details of it. What we're saying are 4 key things: being able to predict, intervene, then being able to collaborate, and then being able to integrate the rest of the hospital system with this movement. of patient experience. So let's talk about the prediction part. So the machine learning model, actually predicts the PX score or the HCAP score. The advanced AI techniques that we are deploying identify not just the score, but the impact factors, exactly what needs to be done, and then being able to trigger an appropriate intervention for that. So that's the prediction part of it. The intervene in the real-time part is where you are able to trigger the exact action that the person with the right skill, with the right principle of compassion skills, like empathy or gratitude, humility, etc., identifying the bandwidth you have available. So think of it like within the floor, you have 20 nurses. Which nurse is best suited, has that right skill to be able to intervene in this moment in time with this particular patient, right? So that intervention framework is intelligent. Think of it as a robotic process automation that is being driven by that machine learning engine to be able to tell it precisely where to go, what to say, to whom, and which person has to take that up. So resource efficiency kind of builds right in there. And then, like I said, what's the most appropriate care team member, but also beyond. So there's a lot of times you have to, align the transportation or align the nutrition services or the anesthesia service. Now, all of them, once are into a social network of collaboration against a particular intervention in the real time, taking pictures, sending voice messages, doing those things which are going to create a very positive mindset within the team that not just they are making a difference, but they're all doing it in the real time as well. So the collaboration part is where, like I said, creating a collaboration between all the care team members and beyond on that particular intervention. And then finally, you have to integrate this whole thing with the existing technologies that the providers are using. So you can't really have another sort of a siloed approach to it. You've got to connect that to the EMR. You've got to connect that within the patient portal. Think of it as a real-time layer on top of the patient portal. What you do on the patient portal is you do your appointments, you see your test results, and everything you see is either you are trying to do something in terms of appointment or informing the provider or reviewing what's already been done. Now this layer, this real-time layer is going to help identify what the next step should be and keeping you in the know as a patient while all those great things are being done for you to help you, and you can have your voice in there through surveys which are real time, not the after the fact surveys, but also quick comment that you can drop in the patient portal while those collaborations are happening for making the patient experience better for you as a patient. And then while we're talking about the integration, obviously it has to be HIPAA compliant, it has to connect with the epics and cerners that these hospitals have and the patient portals too. And finally, the movement. So before I go there, let me kind of show you a little bit. I don't exactly promise you to show the whole system here, but just maybe see if you can take a quick look at some of the screens that we're actually talking about so that you can kind of relate to what we're talking about. So here you see all these different bubbles which are predictive based on the machine learning model and then what needs to be done in the real time. You also see a heat map here for the different touch points. So the different touch point, the bed, the registration desk, the ER waiting area, all the heat map and what the temperature is for different patients right now. And then being able to look at all the what we call intervention cards. So these cards are kind of giving you an idea what's the best next action that needs to be performed, and it's actually routing them to the right person with the right skill and the availability to do those certain things. And then being able to look at that and then intervene on them and then collaborating as part of that whole process. What you can also do is also look at the patient, not just from an EMR perspective, but also from a intervention timeline perspective, so that in the moment of truth, you know exactly what needs to be done at this point in time, what is the queue, so that you can actually intelligently route those actions to the right person who can actually take those actions as well. And then having the pulse of that patient experience, what are the things that are impacting that, whether it was a drive time, it was 12 hours drive time that they had to come in with, how are they going to be feeling when they're going to enter the ER and then stay another 2 hours or 4 hours, 6 hours there, so as opposed to somebody who's just 15 minutes, just 2 blocks away from the hospital, and they can always go back to their home. So they're they can sort of self-manage their stress, if you will, as opposed to somebody who just can't do it, is completely dependent on the hospital to provide that care. So think of those nature, so this is just kind of a brief idea, and this is sort of from a management perspective. All these sort of machine learning model driven insights are going to help plan better in terms of and creating a leaderboard within the organization, who's actually intervening more and earning points based on that, and so on and so forth. So yeah, so we've been working on the framework and then on the execution part of it, but it's extremely important to understand the other aspects of it, which is how do you go about this. So let me open up a slide real quick, and then you can look at that. Just give me a quick sec. Okay, so having said this, what we are here to do as part of this webinar is to launch this, something we call a PX movement. And we would love for everybody to join in, either you're on the provider side or on the patient family side, to join this movement. And what that movement is all about is actually create a framework, a thought process, guidelines that can help all of us to actually do that patient-centric transformation at our hospitals. What you can do is, as a starting point, you can schedule an appointment for a 1-hour strategy session where we can all group together to give you insights, our experiences of what we've gone through in the past couple of years while doing these sort of transformations. So feel free to go to the website pxpulse.com/appointments. You can book a 1-hour strategy session where you can take you through some of the learnings and kind of try to contextualize it within your settings. The other thing we are doing, we've just started and going to keep doing, is a monthly PX dinner. We're starting out from Houston in Sugar Land, and then we're going to roll it out to other cities as well. Where again, the thought leaders and the PX champions, you'd like to get them together, the patient families and the providers and the nurses, to think about what's the next best thing that we can do as a group in order to improve the patient experience and make it better. And finally, we can even come over to your hospital for a full day strategy session, if you will, to kind of deep dive into different patient experience objectives that you have, the roadmap, the patient journey mapping, and how can we bring it all together from your standpoint. So with that, I would open it up. With 4 minutes left, I would like to open it up for the Q&A. Would love to hear any questions that you might have.
So, Ali, I had gotten a few questions on my text, and the person who, just Dr. Russell Schiff, who had texted, and he had to go see a patient. So his question was that all the stuff with the patient we already know, but how is AI product really going to change this? And the second question he wanted to know was, who's going to put in all this data? Like, we're all tired of putting in data, and who's going to put in all this data?
Sure. Yeah, let me quickly touch upon that because I think my screen share was off when I was going through those screens to kind of give you an idea of how we can use that data to make that difference, right? So what we are talking about, the 4-step approach with that. One is the prediction approach. By connecting all these data points, what the machine learning model can do, I don't know if you can see my screen. So I want to make sure.
Yes, we can.
Okay. So the machine learning model, is able to predict the PX score and also the HCAP scores ultimately. And the advanced AI technique identifies what is impacting those scores. And then being able to identify that, you can identify the most appropriate action or the intervention that can be performed in the real time. The next step is the intervention in the real time. So obviously, unless we're not talking about collecting all the data, we're talking about making use of all the data that's already there in the EMR or already is getting collected all the time. So the next part is creating that intervention framework within your hospital, so that once that prediction has happened, the impact factors have been identified, what is the next best action that you can do in order to remove that pain? And like we're talking about, in both April's and Cynthia's cases, it was just that within that moment, they wanted that piece of information or a piece of, or a comfort, or some sort of empathy that would have made the huge difference. Because nobody can say that always the outcome is going to be the best possible, but everybody can give the best experience possible. So that's what we believe, that the the X part, which is the experience part, is getting more and more intervened into the O part, which is the outcome part, right? So how you make people feel is what stays with them, and nobody's God here, right? So everybody understands that and what's going to happen is going to happen, but how you're going to take care of it. So collecting the same data points and being able to do the most appropriate action, and then mapping it to the skills that you have within the team in order to do that. Like we talked about the 9 principles of compassion that Manira spoke about. How do you map that bandwidth of those skills with the emotions in the real time and do something about that? Finally, we talked about the collaboration part, and how do you create a collaboration social network between all of that together. So those are the steps, and then obviously integrating that with the existing technology like your EMR, your Cerners, and your Epics, and your patient portals is also extremely important, because you don't want to collect new set of data. You want to utilize as much as possible the data that's already available. So I hope that responds to the question. If you have any other question, I think we can take one more before we can sign off.
So I just want to give a little bit of my experience with this. So we've been able to deploy some of this technology at our hospital. And what was interesting is that Ali and his team were able to collect the data that was already being entered at different touch points as part of the system, as part of patient's journey. Every hospital enters data, so picking that data and then using that as a predictive model. And then the second interesting thing was that we actually did show a significant decrease in patient anxiety by building interventions, simple interventions, just even communicating, kind of telling the patients where different things are located in the hospital and stuff. It's kind of a very confusing moment for the patient. So giving them that, telling them that the team knows about their child, they know about their child's condition, they know what was done in the ER, just simple but very standardized way of communicating, triggered by the intervention by the model itself, helped significantly decreasing that. So having used this whole thing firsthand, I can tell you that it wasn't an added burden at all to our team or to the people entering data that they were doing anyways.
Sure. Yeah. Thanks a lot for that, Babar. And Devyani has to leave, so we'll have just some final parting comment from you, Devyani, on this.
Yeah. So I just wanted to thank everybody who made time to be on this, and I feel it's really important today to start this patient experience movement, so people start trusting the medical system again. Not like the first question I get from a patient is like, well, my child is not well, really don't want to go to the hospital, what should I be doing? They should feel like they'll go there and the child will be taken care of. So I really want to thank everybody who's on this and who's making it their business to address this as a priority. Thanks, guys.
Yeah, and thanks, Devyani, for being part of this amazing movement. So with that, I guess we'll just have one final comment from you, April and Cynthia, and then we'll call it a day. Because you want your voice to start with, and you want your voice to end this webinar.
Sure. So I just want to say I am super excited as a parent with a child that has had multiple visits to the ER. I'm excited to see this happen, and I hope that it comes closer to home where we can actually see the fruit of the seed that's being planted. So I'm excited, and I hope this works out and turns out to be something bigger than what it's expected to be.
Mm-hmm. Yes, I agree. I think I'm left with hope. I said it earlier, and Cynthia just said it, is that hope that we can do this whole thing better, so that you as the hospitals, as the administrators, and us as the patients and the caregivers can come together to make a better experience that's less stressful and that's truly more patient focused while still giving you an increase in financial support that you as an institution needs. And so I think by doing this, we're creating a win for both teams, and that excites me more than anything.
With that, thank you everyone, and thanks a lot for that parting comment, and that's the whole idea behind this. So thanks a lot for being part of this movement with Cynthia and April. Thanks a lot. It meant a lot to us. Thank you everyone for attending, and there's going to be a recording for this. There's going to be emailed out to you guys. So looking forward to having you sign up for the 1 hour strategy session or whichever way you want to connect and take this movement forward. Thank you all. Bye-bye.